everyone. We're getting started for the next part of Future Focus. This is a panel event, so stick with us as we get the camera situated and they do mic checks. We'll be getting started shortly.
A little bit more.
And for those of you who just joined, this is Future and Focus panel event. We are just doing some mic checks. We wanted to get the camera ready for you, so we'll be getting shorted shortly. We're here in Las Vegas.
5.
Great group of folks about to speak.
One more time. 1, 2. 1, 2. He got soft voice. 4. So there you go. 4. Oh, look at this guy right here. Okay, 3. 1, 2. Okay, wait, 2. One more time. We'll ring it out. 2. Okay. 1, 2. This guy right here is, hey, you know it. One more time. 1, 2. One more time. 1, 2. Okay, I got it. Bring it out. And you have. We got 7.
All right, mic check complete. Get ready for the panel event now. Thanks everyone who's joined us. Again, this is the Future Focus event here in Las Vegas.
Okay, could everyone please take your seats? We're about 14 minutes behind schedule, but we're doing just fine otherwise. Okay. What I'd like to do is start a very interesting panel discussion. I'd like to introduce our distinguished panelists first. They have come a long way for this particular program, and they have a lot to offer from their each individual areas of expertise. So I thought to be equal, I'm going to be able to introduce everyone alphabetically. First, it's going to be Dr. Barry Parisi, CEO of Optical. Barry's sitting in the middle. Barry has both an OD degree and a PhD degree in public service. He has served as Dean of Academic Affairs at the SUNY College of Optometry. He's been president of the New England Institute, executive director of the American Optometric Association, and is currently CEO of OcuHub, a health IT subsidiary of TearLab. Next we have Bill Burns. Bill, in the end. Bill Burns is CEO of Encore Vision. Bill has worked for Norwich Eaton Labs, Bristol Myers Squibb, and spent the last 20 years in executive positions with Alcon Labs, most recently as worldwide marketing for pharmaceutical and consumer products. Next we have Kevin Hunter. Kevin, thank you. Founder of Made Eyewear. Bound to visit them, it's quite a facility. Kevin has a BS degree in entrepreneurship from Babson College. He's the manager of the new business development at Rem Eyewear and founder of MadeEyewear.com. Kevin has developed a new and different business model for customizing online eyewear sales that continues to evolve. Next we have Jay Sales. Jay? Jay is the co-founder of the shop at VSP. I've been to visit that as well in Sacramento. Jay has a diverse background of being both a designer, software performance engineer, and a board member of the Aerospace Museum of California. Both he and his team at the shop are exploring the intersection of healthcare, qualified self, and high fashion. And finally, we have Pia Tavares. Pia? Yeah, Pia is an engineer, product engineer with clear vision. Pia's work is focused on driving innovation with computer-aided design, CAD design. She is leading a team developing new techniques for digital manufacturing, also known as 3D printing. This technology has the potential to change the way frames are manufactured, and it does support mass customization. So, I've got a list of leading questions. I'm going to try to take them one by one. Anyone in the panel can answer the question. It doesn't have to be a specific order. But the first one is, everyone here at the meeting has seen tremendous changes in the eye care industry and the delivery of eye care. Change is the one constant that we deal with. So I'd like to start our discussion by asking our panel, which single change has had the most impact on vision care, the industry, and where is it taking us? So where do you think change is taking us at this point?
I'll advance an idea. And it's not a specific tactical element or one strategic. I think it has to do with the scope of optometric practice that's changed over time. And if change is the one constant that seems to drive opportunities for innovation, it's certainly been the scope of practice in optometry. It has continued to evolve and expand, and as sort of like a living document, it's going to require continual expansion, continual adaptation to the technical achievements and innovations such as we see here, and an educational system that's going to respond to that in kind and produce the vision care professionals needed to implement some of the ideas that we've seen.
Change is difficult to predict, but one thing that is for certain is demographics. And I think the demographics of this country and the world is going to force change in a predictable manner, primarily because aging of the population and the burden of disease. We don't hear much about disease in situations like this, but the dramatic increase in treatable but blinding diseases if untreated. And the point just made about supply, that's a known. For the next 20 years, for sure, there's going to be a flat supply of ophthalmologists and a growing supply of optometrists. So to me, looking at that demographic imperative of increasing burden of disease and the reality of a very different supply side of providers, how that comes together is going to predict change.
I can give you the obvious answer coming from me. I think the internet is the biggest change for similar reasons, in that demographics are changing, primarily that millennials are kind of entering the optical market. So people my age, in the 25 to 35 range, the first place we go is to the internet. Whether we actually purchase online or not, that's the first place we look. I think there's a lot of technology being developed, some you saw today, that kind of points in that direction. I think to say exclusively that the internet is where things are going would be a mistake. I think everyone kind of agrees that it's an omni-channel approach, bricks and clicks, as everyone likes to say. But it's certainly driving where things are going in the future. And it's in such a stage of infancy at the moment that I think there's a lot of opportunity here.
So I'll take it one step further. I'm old enough to have been around for the 90s and got to the dot-com eras. Yes, the internet changed everything, but exponentially, nothing is more profoundly taking a hit on humanity than these. Cell phones, people have access to information via their cell phone more than they have access to clean drinking water on the planet. It is the most pervasive technology ever created by mankind. That means exponentially more people have access to information, access, and the ability to find out different avenues of getting the problem solved. Never before has technology been this pervasively put out on planet Earth. That will, if it hasn't already changed, some of the stuff you saw earlier today, access via mobile technology, and in the developing world, nothing is as pervasive as mobile technology. It has changed every aspect of life in India, China, South America. People have access to more information in the middle of the Congo today than the president did 10 years ago, at the tip of their fingers. That is a massive, massive flattening of economies and a flattening of information access.
And another obvious answer for me is 3D printing. I think it's going to change the way we make and design eyewear. We're going to rethink of the construction, because that's what 3D printing allows. It makes us all engineers and makers. So our construction, the basic construction of a frame that we see today may not be what we see 5 years from now. We might rethink it because we have new possibilities, and the barriers that were once held against us in traditional manufacturing will be lowered. You're also going to see more customization due to 3D printing, because anyone can learn CAD software and then go on a 3D printer and design something that is all their own, something that wall and show them a brand of wall of brands to choose from. They want something that reflects themselves.
It'll also localize manufacturing.
Yes.
It'll take away the need from the directive to go to this point of that source. It'll bring it to the people closest to them.
Exactly.
Or into their bedrooms.
Yes. The most hopeful hope that it will make it into every home in the United States.
So here's another question I'd like to ask the panel. It hits home to everybody who's in practice today. Most eye care professionals are incorporating electronic health records into their practice. I went to a recent physician for a follow-up, and he has a much better relationship with his keyboard and monitor than me. It's kind of like, okay, let me put my data in. I was kind of a distraction for him to be able to get things entered into the record. It's amazing how that's changing. So now the IT sector, the health IT sector, is talking about the post-electronic health records era. What exactly does that mean to healthcare providers that now we're at the post-electronic healthcare area?
Well, I'll start from responding to your point. As a practitioner, electronic health record is an electronic file cabinet. And right now, the nature of that interface is one that's requiring the physician and the optometrist to work with the screen and the keyboard. And so the newer technologies are going to make that a lot easier and hopefully change that dynamic. So the provider isn't obsessed with the file cabinet. But the post-EHR era is actually more about what's expected of this healthcare delivery system. We have a new healthcare economy. The expectation from the new delivery systems, value-based care, is that there is better connectivity, collaboration, and integration. What does that mean? It's not just your file cabinet, it's the fact that most of the opportunities to improve care, to lower cost, improve patient satisfaction, get better clinical outcomes, has to do with transitions of care. That's when you go from one physician to another, from the optometrist to the ophthalmologist, from the primary care physician to the optometrist. And that's part of the space that our company, Optical, is focused on. Because we think by delivering enterprise technology that links all of these EHRs and addresses the problems with transitions of care, we're going to improve quality, lower cost, and improve patient satisfaction. So there's a lot of activity now. In fact, most of the investment is not in the HR sector. There's not much innovation going on there. The investments and the opportunities are in the continuum of care technology, which are this new concept of enterprise platforms, cloud-based platforms, that bring together providers so they can collaborate, coordinate care, and integrate their practices.
See, I see. Post-EHR, EMR, I see it more along the lines of the age of context. We're now moving into a point where context drives what it is that the individual needs, and that whole information exchange has to be driven by possibly the consumer to lead to consumerization of healthcare, where the consumer owns their health data, and they can move and go where it is that the consumer gets the best value for their data. Those are the post eras, but
that's part of it too.
Yeah,
that's exactly. So it's if you think of all of the stakeholders in care, the physician, the patient, the payers, the health systems, and so that's where the focus has to be. And this is where the technology is there, but people haven't adapted all these great innovations in telecommunications.
Yep.
I mean, for example, why can't you and I as physicians communicate with mobile technology that exists? Deploying that in eye care is what we're doing at Occupy.
Well,
and
why
that's
doesn't
what changed things.
IoT feed into the EHR EMR to give you context on that patient as to why it is that they're under that condition, under that time?
Absolutely.
Versus coming in, having that conversation one-on-one, which is extremely important, and then taking the next 5 minutes on the EMR EHR away from the patient.
Or spending half the time talking to the patient about information you should already know from your last visit. And and how does the patient feel in that environment?
Yeah.
My goodness, this physician doesn't even know, and they're depending upon
It changes the dynamic of the company.
Exactly.
To me, it's a very interesting topic. I became a professional editor for Optometric Office. It's a journal that provides provides information on technology and products. And the article I have from an optometric author in November talks about electronic health records. And his quote to me was, "The electronic health record is your best and only defense for patient care." The data in that record, even though it may be the patient's data, is the only thing that's going to protect the practitioner. It's going to help with reimbursement and provide some methodology of if something did go wrong, what happened and why. So.
And I think what you point out with millennials, I mean, the millennials are going to want to be engaged, right? But if your provider isn't participating in a way to share that information with you on a cloud system you can access, then you're going to feel cut off from your care. And you're going to select preferentially those providers that are integrated. Not the solo doctor, but the doctor that you can see is part of the community, that is connected with their other colleagues. If you feel someone isn't connected, they're isolated, you're going to make that judgment. They're not for me. I want someone who's on the grid.
Even from us as a company, we get a lot of people coming to us that, I mean, they don't know anything about their prescription, about anything that they did with their doctor, and they just ask us to handle it for them. And we have such little access to anything out there, and doctors are very afraid of the online world, so most will even refuse to talk to us.
Right.
So there's just such a disconnect between patient, doctor, retailer, online retailer, that it's just kind of beyond our grasp.
We have to all work together to fix that.
Let's shift gears a little bit. I want to talk about e-commerce because e-commerce is slowly building within the ophthalmic industry. Last time I checked, it was probably between 10 and 12%, probably increases about 1% a year or more. Nobody wants to be left out. There are a number of key players kind of practicing on the edges, just kind of see where it's going to go. What needs to be done to create more growth with internet-based eyewear sales? And some of us may not want more internet-based sales, but I suspect it's going to happen anyway. But if it's going to increase, what do we need to do to make that happen as an industry?
Oh, that was directed at me, I think. I think first and foremost is investment, and this is where I think I pitch everyone in this room that we're in a round of funding. So, I think the first place to look is at Warby Parker. They just got a $1.2 billion valuation, and they're not that big of a company relative to the entire industry, and it's mind-blowing to me that they've been given such weight in this industry, not even just the online world, the entire industry. Warby Parker they're the next big thing. And they haven't convinced me of it, but I think there's such a lack of investment anywhere else that they are the only one that could possibly compete because they just raised 120, 150 million, however much it was. And no one else can do anything about it. There's a lot of companies that existed 3 years ago that were trying to compete with them that no longer exist. We at Made Eyewear are lucky to still be around. We have a lot of support in other parts of the supply chain that make that possible. But even from our side, we can't compete with Warby Parker without any significant investment because they're just dumping so much money into not only online but into the brick and mortar side of it as well. And there are companies, people in this room are running companies that have no real inroads into the online space, just because there's no investment into it. I know there are people trying it and just kind of experimenting with little things, but it really takes significant investment to get anywhere. And even from Warby Parker, I don't view Warby Parker, in certain senses, yes, they're very much a competitor of ours, but I also see their success, or relative success, as kind of helping our business as well, because they're training consumers to buy online and to learn about our online, which is just making the entire industry, it shifts the industry, but it takes a lot of money and a lot of effort to make sure that it actually goes somewhere in a useful direction. And I just see a huge lack of investment across the board in what we're trying to do.
I think it's interesting in terms of, we're talking about Warby Parker. Warby Parker did exactly what Clay Christensen will tell you disruption is. It's good enough. And they create an experience that makes people feel special by being a part of it. It's good enough. cheap, good enough, more accessible, and touching a market that wasn't going to go to the eye doctor in the first place. That's what disruption is. But what's even more interesting along that line, as this industry goes forward and the medical industry moves into telemedicine and people get used to the fact that they can talk to their doctor on their cell phone, FaceTime, or telemedicine, any kind of experience, and they're talking about their cancer that they're being dealt with, and they can't get any information from their eye doctors, that's going to be an expectation change. The expectations are going to shift in the next generation as to why the hell can I get it via this methodology, like I can in the rest of the medical industry. It's going to happen at one point or another. There's no silver bullet for what it is to take for everything to change, but a large part of it is alternative manufacturing possibilities. Reducing the cost, reducing the time to get to market for a pair of frames, and then reducing the 2 weeks that it takes every single person to get their glasses.
Exactly.
And we're seeing also from an innovation technology side as well. When our customers are required to go and see a doctor to get their eyes tested, they more often than not don't leave that office without buying a pair of glasses. So, I mean, we're launching something tomorrow, a beta test with a company called Alternative, if anyone's heard of it, which is an online eye exam. So you no longer have to even put pants on to go through this whole process. You take your eye exam online, it leads you straight to our website, you buy the pair of glasses, we get your prescription, and it's done. 15 minutes, you don't have to do anything, never leave your house. And I think investing in that sort of technology and innovation is going to go a long way as well.
Nobody would have, 30 years ago, nobody would have thought about buying an airline ticket and just getting on a plane. They would have gone through a travel agent. Gone. It's completely been flattened. But it's because they don't have to do anything to do it anymore. They just go.
I like to call it a refractive selfie. That's what it can be, right? A self-advancement test. And because even now, there's technology to do a retinal selfie for a diabetic patient that you want to monitor their retinal changes of simply having a picture. I think these things are inevitable, what's going to happen, and clearly there's going to be a lot of disruption and concern from a provider standpoint that people are misinformed or falsely reassured that that's protecting the health of their eyes. So if that's accommodated, then this is going to, I think, expand dramatically. But just to be a contrarian here, when I looked at those slides that Ron Bloom showed, and I was surprised by that, the slow growth in frame and lens sales. And I think underneath that, someone has to really look at another disruptive technology. And as you know, with disruptive technology, everybody overestimates the short term and underestimates the long term, right?
Absolutely.
And that's refractive surgical correction. I think the advances in refractive surgery, both for the millennials and even refractive surgery associated with the elders and the cataract patients, I think that's going to diminish the demand for corrective eyewear. So I think that has to be considering the formulation of predicting what is the ultimate volume of sales, is consider a growth in the number of Americans that choose a refractive surgical approach so they don't have to wear glasses in the first place. We'll see how that plays out.
Thank you. I wanted to talk a little bit about 3D printing, about digital manufacturing. Because I have a vision, and the vision is that someone makes a machine, let's say a frame company or some independent company, and just like laboratories can download a digital format for progressive lens and pay a click fee, that this small 3D box will be able to print out multiple frames of different designer styles in the office, and the practice pays a click fee to make it, plus they provide the raw materials. Now, this may be something way far in the future, but I wanted to kind of ask our panel, maybe you can start. What do you think about it?
Well, I think that's definitely where we're heading. I'm going to say in the next 5 years or so, you're going to see more mass customization. It's not just going to be an issue about how does it fit on your face. It's going to be a style issue as well. 3D printing is going to let us shift the physical world digitally. So you'll take a CAD file of a frame, and the manufacturer will either supply it to you, or you might be the own maker of that file. And you'll be able to shift to redesign it and resize it to fit your patient. which takes it a step further into scanning technology. It's going to allow you to scan your patient's face for a custom tailor fit. It's kind of dumb to me to think that frames only come in one size when everyone has a different face. Your frame should fit you perfectly. And this is what 3D printing is going to let you do, because there's no mold cost, there's no minimum order quantities. You can print on demand when you want it, where you want it. It's also going to let us, again, rethink of what a frame looks like. Maybe it doesn't need temples. Maybe the hinge doesn't need to be metal. Maybe it can be integrated. It's going to just completely blow away the market as it is now. If you haven't heard of a company called Luxexcel, they surprised the optical industry just last year. They printed a functional 3D lens in a frame with no post-processing, and that's a huge step in 3D printing. And that's the future of manufacturing, in your office, in a patient's home. And to kind of tie it into what we were saying about millennials sitting on their couch, yeah, give them an eye exam that they can sit on their couch and then have a little FaceTime conversation with them, and then tell them, consult with them, tell them this is what I think will fit you, scan their face, and then have them print something in their home. They don't want to leave the house, and it's only going to get worse.
From our perspective at the shop, we're working with MIT Center for Bits and Atoms, very closely, Neil Gershenfeld's group, as well as Media Lab, which has Mary Oxman, which is doing a lot of work around alternative manufacturing. But all of those coming together, and we visited Luxexcel as well. When you start to see the Luxexcels and the Center for Bits and Atoms start to work it into, where you can put the lens and the frame in the same job, then you've changed design. Once you've changed design, you open up a wide swath of possibilities. Just like Peter was pointing out, it might not need temples anymore. The whole paradigm changes once you get into that zone. Right now, it's when we get the right optical quality,
Yes.
the right optical quality and the ability to not have to have right angles on certain aspects of it. But it's really interesting to see what's going on without post-processing right now. It's really, in atomically precise manufacturing, it will change the game. Already today, we're doing tooling without having those that's
Yeah, we're already making strides with what the technology can do now, and its stronghold is in prototyping. And it's allowed designers to test out new ideas rapidly. So they have an idea, they're able to print it within a couple of hours, and then even test it in the market and get the feedback back, and then go back to their computer and redesign it, and then check it out again in 4 hours. It's outstanding. Like before, you had to wait 8 weeks just to get your first prototype. Now you're down to maybe 2 hours, and you have a prototype in your hand that you can show to someone and get opinions and move forward.
Okay. Here's another question I think everyone here would like to have asked, or at least answered. Presbyopia is a result of aging. Happens to everyone. We have the fortunate ability to live long enough. Every presbyope I've ever examined didn't really want a pair of glasses or a pair of contact lenses. They wanted their focusing. So how close are we to getting focusing back and treating a lens that no longer can change shape?
Well, the objective of Encore Vision's research is to provide a reducing agent, basically chemical reduction reaction in the lens and make it soft again so that you get the curvature needed to increase refractive index. So how close are we? Well, we know with the approach that we're taking with the drug that we can soften an animal lens. And an animal lens that's more difficult to soften than a human lens in particular. So I think we're on the right track. And the clinical study we're about to implement, we're actually screening patients right now for the study that's going to last 3 months, and early next year sometime we should have some kind of a clue as to whether we're on the right track or not. And how close are we to a drug that could be followed all the way through to an NDA and a commercialization? Probably 3.5 years yet. And I think the pharmaceutical industries will waken up and is wakening up to the tremendous potential that exists with this huge population of people that have been left fallow basically for a long time. For some good reasons. I mean, there were other pathologies to spend money. Glaucoma, age-related macular degeneration, diabetic conditions that affect the eye. And presbyopia is not a sight-threatening condition, but it sure is an inconvenience when you have to pick up another pair of glasses, or if you never wore glasses before, and put them on. But there's this sleeping giant out there of individuals, demotropes, who never had to put on a pair of glasses. And when they first pick up glasses, have to wear them, can't see the dashboard, can't see your grandchildren up close, you have to push them back further away to see a face. They really don't want to wear glasses. And so the enormous potential that exists for a pharmaceutical treatment that's not surgical, that's very simple, a simple intervention that can restore some function is just tremendous. And I think the pharmaceutical industry is going to waken up to that, and is wakening up. But it is a complex event in which to intervene and try and figure out how to do that as gracefully as possible. I think Encore Vision has been fortunate in finding a natural agent that could be combined with another natural agent that, when it comes apart, it's two natural agents that are in all cells or needed by all cells. So it's been clever. We haven't had to spend the $1.4 billion and the 14 years that are required for a new chemical entity, taking it from inception all the way through to commercialization. So very fortunate in that regard. Sometimes you just get lucky. But I think the pharmaceutical industry is going to waken up to this massive giant. And I think the technology that Encore Vision is bringing to this in terms of an understanding of the physicochemical, the physics involved in accommodation will certainly be very interesting to see the reaction to it.
I think this ranks as transformative. It's just the highest level of innovation in getting to that point. Because I can, you start thinking of all of the repercussions of, even if you just moved a modest proportion of presbyopes into preventive intervention, the ramifications that has throughout the sector.
It's a big ripple.
It's a big ripple.
Anybody else want to take that on?
Beyond my fingers.
Okay. Let's talk about smartphones. Yes. Frank, do you have a question? We will. We've got just one more to go. The smartphone has really transmuted. It's changed a lot of what we do. When you're at Vision Expo this week and you watch people waiting in line, no one is waiting in line. They're texting, they're tweeting, they're photographing, they're reading the news, they're emailing, they're doing all kinds of things with their phone. And because of that, I feel wearable technology is just on the next building. And we've heard a lot about that today. I really need the panel's feedback about how the electronic industry can move forward.
So I can jump on. In the shop, we've developed something that's called Project Genesis. And Project Genesis is basically, within these frames that I'm holding right now, is a gyro, a magnetometer, accelerometer, Bluetooth, and a battery. And I've been wearing it for 6 months. So it's capturing all my calories burned, calories, my steps taken, and we get further and deeper into that. It is the proper place to do wearable technology. The wrists and the legs are probably the worst place from a biomechanical engineering point of view to actually do wearable technology. Wearables, though, is just part of the aspect. This is connectivity. This is IoT, or the Internet of Everything is what it comes down to. For us, it's about enhancing our members or our consumers' health records and actually giving them much more context into their health aspects to understand itself and allow them to own that data as well. So wearable technology, IoT, all of these are intermixed, and it's the interoperability that'll have to come about that we're going to try and help drive. But for us, it is not something that's a possibility. It's something that we're working on and driving towards today. Just the gate that we can pick up off of people at the center access is a whole different game than you can anyplace else. We've been working on that for the last year, and our prototypes have been. I've been wearing this thing for 6 months, and I never think about putting it on because I have to put it on. I wear glasses.
more general smartphone side of things, not necessarily wearables, but just smartphones in general, it kind of loops back to the idea of kind of self-administered eye exams. There's companies like Inetra and Smart Vision Labs that are doing iPhone eye exams. I don't think it's quite to the point where someone could do it on themselves yet, but it's going to get there. So I think that is definitely where things are going from a smartphone perspective.
Another smartphone perspective is about communication. So I have 3 accounts on my phone. I have my corporate account, I have my personal account, and I have my direct message account, which is my HIPAA compliant and U2 compliant way to move defined data sets from EHR to EHR. So I can view that in real time rather than importing by EHR. I can view this, my optical account, if you will. The other thing I have is access to a server in Chicago and 2 other locations where we're testing the sharing of images. Right now, we depend upon sharing ophthalmic images by going from my practice to your practice, big files. And if you don't have the same technology I have, you have a different OCT, you can't look at the image. But the new technology of vendor-neutral archiving and vendor-neutral viewers is changing the way we think about sharing clinical images. We don't have to be bound to proprietary formats that many of the imaging companies have. So another breakthrough in interoperability and care coordination is actually right here on our phone.
The open source of healthcare will happen. It is happening now. It will happen a lot quicker in developing nations. That's just very clear. What we're going to see is the reduction of CPT code duplication across the board. When those interoperabilities and the proprietary nature of medical devices gets put to bed, that's when we'll start seeing a reduction of costs in healthcare.
Well, one of the reasons I think that's going to occur, because I agree with you, is in developing countries, they don't want to make mistakes the U.S. is made about
like putting down cable for the internet.
Well,
they put up towers.
They put up towers, right? but for example, with care, they think about populations. They think of the most cost-effective way to serve a population of patients. And our system, our new healthcare economy, our value-based system, is converting to systems that reward providers to care for populations. So for those of us in the room, who practice optometry or ophthalmology, within 3 years, 50% of their payments are going to be value-based. They're going to have to demonstrate that they're attentive to the care of a population. And right now, they have to go beyond their file cabinet at AHR, which will not help them caring for populations. They have to be part of a larger electronic community so they can monitor the impact of what they do on a population. Right. And that's that really flips things around, because you're rewarded not just to do a lot of stuff, but to make people better. And
the individual, their health will become an asset category. It already is an asset category in many different populations. But health, your individual health, the population health, that will become, rather than GDP, a better calculation of assets within that organization.
Well, take the cell phone to the manufacturing side of things and the product development side of things. You know, as we're sitting here, I was reviewing the IRB comments to our clinical protocol this afternoon back here, and trying to move that forward. Encore Vision is a virtual company. And so we're working with people all over the place, no bricks and mortar, remarkable team of folks that can get a lot done economically. And our development costs relative to any traditional pharmaceutical product development is fractured.
You go with the best people.
You get the best people where they are.
What I like to do, because I know we have just a few minutes left, I want to open this up to questions from the audience. If you have a question, we have someone with a microphone that can come and come to you. But we have such a distinguished panel; they know a lot of information. If you have any questions, please let us know. We'll try to have them answered for you. Anyone? Yes, ma'am. Microphone's on the way. There you go. Thank you.
Okay. Did I read this? Isn't Australia going through that process of connecting everybody in Australia? I think I read that article a couple years ago. All of Australia is going on. Everybody has to have EMR. They're all going to be connected.
Yeah, the point being is that they're primarily driven by hospital systems because that's their focus, and because eye care is outside the realm of hospital systems, we have to address it within our community. And so,
do you think it's going to happen here? I mean, do you think that everybody will be connected and every doctor will have access to every record? And
okay, so here's a point about the difference between sort of open access. You know, physicians want to convey information point to point rather than saying, you can look at my entire record. So the technology that we're involved in, and I think the technology that will dominate, is technology that still allows providers to define the key information, not just big data dump, but what's the information that you need as my colleague to take care of my patient? And then what does the patient need so that the three of us have the right data set? If you dump all the information at once, it doesn't work. And so that's why some of the early experiments in having people be able to look at entire clinical records is not working. Point-to-point messaging is still going to be a big part of the collaboration. So a lot of people working on it, and that's why in eye care, we have to get our act together because the rest of healthcare is kind of far advanced.
I'll take it a step further, and maybe a little bit more controversial. In the next 20 years, I believe it'll flip from do you take my insurance to do you take my data? Rather than do you take what I have coverage for, do you take my context? So the consumer will drive the ability to actually make those choices a lot more. But it'll be because of interoperability, with that possibility. And then you'll just, once that person's taking the data, I'll say, do you have my STL file? Print that sucker out, get it to me through a different means, and things are going to rapidly change. It won't happen tomorrow, but it'll switch from why it is that you've got access to this doctor, because they take my data.
Well, there are compatible sets now. I mean, so there are a lot of standards. It's about setting standards, just like anything else. And this is a case where there's been some standard setting so that there's defined data sets that can be shared. And so for most practitioners, there's actually a lot more that can be done to share information today than what's actually happening. And eye care needs to catch up to what's going on within the health systems.
Eye care medical will adopt things like, well, TCP/IP is a perfect example. That's a protocol that's defined. Everybody can talk TCP/IP
It's the
across
same
networks.
concept. It's the same concept. Yeah.
Protocols need to be adapted.
We have time for another question in the audience. Dean? I don't know if you'll need a microphone or not.
No, really, it's sort of okay, here's the microphone. I just want to say that I think the natural outcome of the evolutionary things that we're seeing in the market today is going to be the decoupling of eye exams, the health department eye exam, from refraction. I think they're going to be totally separate, as they are in most of the rest of the world already, and we're going to see a total change in what optometry is as a result.
That's disruptive. Another question? David?
So my question kind of follows up what Dean stated. Today we saw a lot of technology that is certainly disruptive, but most of the technology that was given as an example, Uber or Airbnb, Blue Apron, etc., is very obviously consumer driven. My observation is that a lot of the technology that we're talking about is either, if it's government driven, healthcare, or otherwise, it's not consumer driven. So my question kind of follows that up. So to millennials, the question is, are we going to be buying eye care and eyewear the same way we do now as compared to the old guys over there?
Are you grouping yourself in
I'm putting myself in millennials. Are you guys going to be buying it the way that we sell it today? And for those guys over there, what do we really see as why will it remain the same? So why will it be different? Why will it remain the same going forward? Eye care and eyewear. Because I'm thinking no one buys frames and lenses in the future. That's what I'm thinking after today. So I'm asking you guys why they will, you guys why they won't.
going to agree with anything he says.
Well, I mean, I think we touched on it a little bit, but it's just our mentality as millennials is we don't like to leave the house. Or put our pants on. I don't like pants at all. That's why I love it. Anything we can do that we can just do quickly and efficiently without having to go anywhere, that drives our decision making. And it's kind of mind-boggling to me when I first got into the industry 5-6 years ago that the online world there was nothing synced up with eyewear and online, and it's a really antiquated industry to me, especially when you look elsewhere. So many other industries, most industries, are so intertwined with the online world that it makes our lives easier. And eyewear just doesn't seem to be the case for me, and that's what I'm trying to solve, and we're trying to solve at Made, and I think everyone is trying to figure out. So, I mean, to me, it's just whatever makes our lives easier is what's going to drive the future of the industry.
I think the younger generation is also, God, I can't believe I just said that. They're a lot more community driven than people give them credit for. They are part of an experience. They want to be part of an experience, and they want to be part of this community. Now, it doesn't have to be the community that's physically around you. It's what others around me are doing, whether it be within my network, it's an experience that we're looking for. It's looking for valid, useful experiences that change the way we do things. And if that means going online, that means going online. If that means going to a Warby Parker store where I feel like I'm in an Apple store, but I'm buying nothing but a pair of glasses, I'm going to go do that. It's going to have waves and flows going over the next decade, but it's going to move and shift.
And that's why social media has a huge influence too. Instagram is one of our biggest drivers of traffic. It's because people are just tagging and sharing, and you like that person's eyewear, you're going to go to our site. Our best-selling frame is one that is posted on Instagram by a top blogger, and instantly we just see thousands of people looking for that frame.
Instagram's a perfect example of that. Yep. Kodak at its height was at the height of Kodak. The top of the line when Kodak was running. It was 56 billion pictures were taken when Kodak was at the top of their game. They invented digital photography. Today, 2 billion images a minute are posted online. Instagram being one of the major providers. Kodak doesn't exist today. So they invented it and got themselves taken out by it. These things change rapidly.
They undervalued it.
Well, they were afraid that it would hurt their paper sales. Yeah, they were afraid it would hurt their paper sales, so they tried to bury it.
They weren't willing to disrupt their own business.
Exactly.
But if the question is about frames and lenses, okay. But if it's about pathology, then that's a different situation even for the millennials. Even though the method by which they receive care may shift a bit, the world that I live in, and you still have to do something about it. That's going to drive you to at least what we know today is more of a traditional means of healthcare delivery, eye care delivery. And it might speak to the point made here earlier, optometry is probably going to change quite a bit. That was the point I made earlier. I think it's the scope of care, or the scope of practice that's going to change. It's going to be different as things move forward for a host of reasons mentioned here.
I think if the vision care industry wants to do it, it is the tip of the spear for digital health. You have direct access to the central nervous system and the cardiac. It is one of the brightest, clearest windows into your health that can be provided today. Whether it be a smartphone or however you go about getting that information from the eyes, it is one of the tips of the spears for digital health in the future. Imagine checking your eyes every single morning, having a fundus image taken, and the algorithm checking whether or not diabetes has progressed. And it gets longitudinal data over that period of time and says when you need to go see the doctor, or measuring the shape of the retina, and then it automatically says it's time for you to get 2 drops.
Yes, one last question?
Yeah. Before I ask my question, I just want to make a note. I have a millennial at home, and she's never. Okay, so I guess
She's somewhere though. Someone's home.
It seems almost to me that as technology advances, we're going back backward in time to a point where, unlicensed people at carts on streets used to refract you with lenses over your face and give you a pair of spectacles. So my question is basically this. That was in the days before government got involved and regulated licensing in the industry. How concerned are you in your perspective ends of this industry to the effect that government is going to have and litigation is going to have on moving you forward?
That's why I primarily focus on the developing world for these sorts of things. It's where the impact can be felt instantly. And regulations will slow things down here in the United States and the EU. The financial burden of the legal hassles that will cause will slow things down. It is the rising billion of South America and India that will make this change be forced. Because you'll see impact on people's lives. It'll actually make a difference. One kid who has access to iNetra goes on to study at India Institute of Technology and basically comes up with the algorithm that solves the multitude of solutions. It was that vision correction that got that change. Those are massive impacts that vision correction can have in the developing world. It's just waiting to happen. It's too bad it can't happen quicker.
Well, we have run out of time. Don't let anybody go anywhere. Before we get up to the award ceremony, which is coming up next, and then finally the cocktail and networking reception, on behalf of the attendees and also the Future in Focus, I really want to thank this group, Hugh Taveras, Kevin Hundred, Barry Parisi, Jay Sales, Bill Burns, for their expertise and sharing their insights. So, thank you very much.
Okay, folks, we just wanted to hand out the 2 awards to the
What's he doing on my mic?
Hello. Now it's yes, you try. No. It's the magic touch. And you'll watch this. Oh, stop it. Listen, we do want to pass out the award. Thank everybody for being here. Very much appreciated. In fact, there's going to be a social security network. At this point, let's talk about the Innovative Invention Award. That went to the prescription programmable display. Let's hear it for Dr. Brodsky. And the most likely to succeed award went to the Electricity Corporation.
On behalf of Ron and myself and the team, I'd like to thank you all for coming. I hope you enjoyed yourselves today. I also wanted to thank my particular team, First Vision Media Group, Jeff Corvo and Sharon O'Hanlon, who did a masterful job of helping to coordinate, and our meeting producer, Dr. Richard Pompous. So thanks. Let's all go have a drink and be well.